Hello all, this is Dr. Kaustubh Mohite, your pediatric pulmonologist. Here, I have started this new video series in which I shall be making such short videos which will help you understand the basics of some important topics related to pediatric pulmonology. As a pediatric pulmonologist, we quite often see cases in which we have high suspicion of cystic fibrosis. So let's understand what exactly happens in this disease pathology. Cystic fibrosis is a genetic disease with autosomal recessive inheritance. The main reason behind this disorder is the mutation in the cystic fibrosis transmembrane regulator or the CFTR gene. In a normal human being, this gene mainly controls the transfer of chloride and sodium ions across the channel present on the apical membrane. These channels are responsible for efflux of chloride ions from the intracellular region to the luminal region and the influx of sodium ions from the intracellular region. Also, it is responsible for efflux of bicarbonate ions into the luminal region, which maintains the relative alkaline nature of the luminal secretions. It is because of these ions that the airway surface liquid layer is well hydrated, which helps in effective mucociliary function. In cystic fibrosis, due to loss of action of CFTR gene due to its mutation, there is downregulation of chloride channels, preventing efflux of chloride ions and upregulation of sodium channels, causing increased influx of sodium ions. This leads to increased intracellular osmolarity, which pulls in the luminal water molecules in the intracellular compartment. This eventually leads to decrease in the hydration of airway surface liquid. Also, mutation in the CFTR gene causes downregulation of bicarbonate channels, which leads to increased acidification of the airway compartment. This depletion in the airway surface liquid leads to defective mucociliary clearance, which further leads to mucus obstruction. Such sites become the nidus for infection and inflammation, which eventually leads to bronchiectasis and finally respiratory failure. Like the airways, similar pathology is seen in liver, gastrointestinal system, genitourinary system, pancreas and skin, because of which cystic fibrosis presents with such multi-organ involvement. I hope this short video was useful to you and to understand the basic pathophysiology behind cystic fibrosis. Kindly like, share and subscribe to this channel so I could keep more of such short videos rolling in. Thank you.